got some sharp pain in my lower back. It started when I was drying myself out of the shower.
You know, it all started when I was tying up my shoes.
Had a big day on the tools with the boys yesterday. Now I've got a real sore back.
It really hurts when I move in certain directions.
Oh, it hurts when I get out of the chair and it's very uncomfortable at night.
Feels nice when I stretch it, but only for a little bit.
It's really stiff in the morning, but then as I move around, it gets better.
Very pinchy and achy.
I had that before, but after 2 or 3 weeks, it got a bit better.
What is that?
What we're dealing with in these cases is what is known as a lower back or lumbar facet sprain. Around every joint in the body is a thick layer of glad wrap, which makes up a capsule around every joint. This joint capsule helps protect the joint, but when it becomes irritated for whatever reason, it is known as a sprain. Now, when this happens in the lower back, it can give off that sharp, pinchy or stabby feeling in a specific area. In response to the joint sprain, the body actually tightens up around the area by tightening the muscles up. This helps to protect the area so that you don't further injure it. This can create a feeling of tightness or stiffness through and around the area. These presentations respond really well to manual therapy. However, for the purposes of today's video, we'll go through some easy management strategies that will target the tight muscles around the area and the stiff joints through the lower back. For today's exercises, a foam roller or a muscle trigger ball will be helpful. To release off the glutes at the side of the pelvis, locate the area by imagining where your pockets would sit if you were wearing jeans. Find the sore spot and stick to it. Work through the area until you feel it ease off. To release off the fleshy part of the glutes, you can use the foam roller or trigger ball as seen. Same thing, make sure you stick to the sore spots until you feel it ease. Pelvic tilts are an awesome exercise to improve mobility through the lowest part of your spine. Imagine you have wheels either side of your pelvis and you're going to wheel your pelvis towards your head. Try to maintain softness through the abdominals and the glutes. If you find it tricky, pop one hand under your back and try and press your hand into the floor. For a simple glute stretch, pop one foot over the opposite knee and stick your bum out behind you. You should feel a stretch through the side and back of the hip. If you are experiencing sharp or pinchy pain through your lower back, try to avoid rotation as this can aggravate things further. Other management strategies that can be super helpful in these cases is to take anti-inflammatories. Now, this is something that you would have to talk to your pharmacist or medical practitioner about. The other thing that can also help is ice and heat. The general rule is to ice 24 to 48 hours after the incident occurs, and then you can use heat thereafter. The third thing, and this will be applicable to only some people, is to avoid high impact activity for the first 3 to 5 days after the incident occurs. Follow these simple tips and you'll be feeling good as gold like Nico. On you, Nico.